Police arrest key suspect in recent war murder case. We'll bring you details and take you live to the Upper West Regional Capital. Also, imagine drinking water from a source polluted with human excreta. A national crisis in waiting as water bodies come under heavy pollution in part of Greater Accra, Ashanti, Western, Central and Northern regions as a result of the continuous discharge of fecal matter and illegal mining.
That this Galamsey menace, we must expand it, because if you really want to get our water bodies, it must be comprehensive. If you go to Tamale, Dawuni, it is not Galamsey, it is Sanwini. If you go to the Densu, Weja, it is not Galamsey, right, but the water there is polluted.
Management of Ghana National Petroleum Corporation GNPC dragged to Parliament's Mines and Energy Committee for its gas supply deal with Gensa Energy, a power generating company.
Go ahead to sign such far-reaching agreements without recourse to Parliament. Why would GNPC decide that they would not even inform Parliament as part of their work program? We are summoning GNPC to appear before the Mines and Energy Committee this very Thursday. We
have details as the ranking member on the committee accuses GNPC of veering off its core mandate and engaging in suspicious deals. Later, Smugglers Paradise John uses expose on how some customs officials aid smugglers to transport thousands of gallons of cooking oil from neighboring countries into Ghana.
So okay, it's a smuggler work. You don't just want to sit when they just see all of them in front of you. Okay. When one enter, take your time.
Okay.
Second one enter, take your time.
Okay.
Third one enter, take your time.
Okay.
So that's how it is.
Okay.
This is Joy News Prime. We are live on DSTV, channel 41, Go TV 144. This is the home of independent, fearless and credible journalism. I am Ernest Minu. Stay for details. Hello again, thanks for choosing us. The police says it has arrested the key suspect in the war murder case. The suspect, identified as Kankani Adongo, was arrested on 19 September 2022 at Bamahu, a suburb of Wa. Now, the police says the arrest was made after an extensive search in collaboration with the Community Search Party. Let's cross over live now and speak to correspondent Rafiq Salam, who has been on this beat for us in the last few days. Rafiq, first of all, clarify for us, was the individual picked up by the Community Search Party and handed over to the police, or we had a situation where the community members were embedded with a police team who then apprehended the suspect?
Apprehended by a search party around Yobet and then taken to the One House Palace and then later handed over to the Wa police.
Right, and Rafiq, I asked this question because of what we are learning of the concern of the Interior Minister and the IGP, the Interior Minister Ambrose Derry especially, warning the people not to usurp the authority of the police. What is really warranting or generating this caution?
When the incident somewhere around Friday, you have some Irish youth that stormed the One House Palace, and later they besieged town, went to some shops and allegedly looted some items belonging to some foreigners. And then the Interior Minister was really talking about saying that they shouldn't take the law into their hands, their own hands, because the police, they are the rightful people to conduct investigations to unravel messages surrounding such incident. And so he's appealing to the youth that should they have see anything untoward, what they need to do is to cooperate with the police and then hand over the suspect to the police. And that is what the search party has really done.
And Rafiq, we know that over 300 police officers are on the ground in what the police describes as a special operation to address the issue. But the overlord did not mince words in expressing his displeasure about the police response. Tell us more.
And according to the overlord, he thinks that that's a knee-jerk approach, considering the number of police that we have in the Upper West region. Let me give you the records. The information that we have gleaned on indicates that the last 2 years, over 1,000 policemen have been transferred out of the Upper West region. And then also about 200 also transferred into the region. The people that have under this transfer are not up to 30. let me cite the instance of the one municipality. Out of 50 that were transferred out of the municipality, there was only one replacement. And so the one is also saying that these are policemen who, some of them who are in the municipality or in the region, have stayed over 10, 15 years. And then they think that they have overstayed their welcome, they have mixed with the people, and for them, because they are mixed with the people, it is really difficult now to fight crime in the region. The one is therefore calling on the IGP to transfer out all policemen and women who have stayed over 10 years in the region and bring new faces so that they will be able to fight crime in the Upper West region.
There was also a specific demand for a curfew by the overlord. Was that granted?
It wasn't granted because that was an interview that we conducted earlier on Friday, which the spokesperson of the world overlord, Kadri Ibrahim, made a categorical statement. But when we put that to the Inspector General of the Ghana, the Interior Minister, he says that as for curfew, it's not only decided by the Interior Minister. We have the RECSEC headed by the Upper West Minister. But when they are talking about a curfew, what really happened is that both sides sit together to review the security situation before curfew is imposed. But for now, there's no way that curfew could be imposed in the one municipality.
Rafi, kindly hold it there for me. We're joined by Peter Tobu, who is a former senior police officer and now a member of Parliament for Wild West and also a member of the Interior and Defence Committee in Parliament. Thank you very much, sir, for your time here on Joy News Prime. So this is really happening in your backyard, and I suspect you may have been following the turn of events, gathering your own information. What do you make of what has transpired so far and the reaction of the police?
Thank you very much, my dear brother. Good evening to your cherished listeners and viewers. I want to say good evening to my brother, Rafiq Salam, for the wonderful work that he's been doing for Ghana's media and very particularly the Upper West region. I think that for the many years that I've known him, he stood firm in the media frontage to ensure that whatever is relevant in the Upper West region is conveyed to the consuming public. What is happening in the Upper West region now has been graduated to a national issue, is of a national interest. The Inspector General of Police, upon hearing the news after the demonstration, took it upon himself to do what is necessary, and he's acted promptly because I think that was the point that he got a clearer picture that things were not right in the Upper West region. Deploying 300 officers to a region like Upper West region and making sure that you send combat teams, special purpose vehicles for investigation and intelligence is the highest that I can think of in terms of approaching a crime that is gradually becoming a menace. What is happening now is that, you see, the Inspector General of Police will get to appreciate the fact that when the people in the Upper West region are crying about low numbers of police, it's a reality. When we are crying about the capacity of the police to manage the region due to their numbers, it's a reality. Today, you've sent 300 men. After the situation is resolved, are you going to withdraw all the men? And I think that I want to thank the overlord of the white traditional area. What he's saying is a reality. What can we do? People have been in the Upper West region for more than 10 years. They actually want to leave, but the system is so suffocating that they are there and they're so frustrated. And when you find a frustrated officer in uniform, he's more dangerous than even a civilian. But
Mr. Tobu, why would police officers would want to leave the region just because they have stayed over 10 years? And you talk about the fact that the numbers there is quite low. If you have police officers who have stayed there for that long, they should be familiar with the terrain, and that should help in providing security to the people. Isn't that a plus? Why should that be a concern, especially for the overlord, as we heard him say, and for that matter, for the police officers who want to be transferred?
I think that the overlord was probably just quoting from the police regulations, or was just quoting from the service instructions that governs police organizations. In the service instructions, saying that no police officer should be allowed to stay in a particular region for more than 10 years, and no police officer should be allowed to stay in a particular station for more than 5 years, unless there's specialized arrangement. But these days, many of these things are ignored. You see, the principle behind policing is such that if you live in a particular community for more than 10 years, enforcing laws becomes a problem. You become a family man. And that is why it's always encouraging that let's have some fresh faces, refresh the system. let them be challenged to do some local knowledge, scan the system, and try to prevent crime and do something solid. After 10 years, I mean, you can't serve all your police life in a particular region and retire. What is the experience that you've gotten? How diverse are you in your police experience? So if you work in Apawu for 10 years, you should be able to move to another part of the country.
Well,
After
I'm
10 years,
grateful that you
around.
could join us. We ran out of time on this, but Peter Atobu, we are grateful that you could join us with your thoughts on this development. Rafiq Salam is still with us on the line. Rafiq, so 6 people confirmed dead, the bodies retrieved, 3 others not accounted for. How are the residents reacting to the development, especially in the last 24 hours, where police deployed to the area, the IGP there, the Interior Minister also on the ground?
The people of the one municipality, I can tell you that are really happy with the deployment of the police force in wherever, whichever junction or intersection that you move to. At least you can spot at least 3 police personnel there. They are happy with the deployment, but at least they want the police to do more. What is happening and what is not only the entire that this incident is happening. It's happening at a particular location around Paguru or the Pokobokole extension. That's where they want the police to have their eyes on. But let me tell you, Ernest, the IGP responded to what the overlord said when he interacted with some of the members of the search party. He said that they are doing their best and they are thinking that that's the reason why they have deployed lots of personnel into town with lots of resources. And then for him, he thinks that they are doing the work, they are not talking, and very soon they will be able to apprehend the perpetrators of the heinous act.
Rafiq Salam, the Upper West Regional Correspondent, bringing us up to speed with development in Wa, with the killings that we've seen in the last week alone. We'll bring you more subsequently. Just stay with us. All right. Hello again. Thanks for staying with us here on Joy News Prime. Management of State Oil Company, Ghana National Petroleum Corporation, that's GNPC, have some tough questions to answer after being dragged to Parliament's Mines and Energy Committee for its gas supply deal with Gensa Energy, a power generating company. The deal has been criticized by civil society groups, including Imani Africa and the Africa Center for Energy Policy, ACEP, as one which will cause financial loss to the state. According to the 2 groups, Ghana buys gas for $98.5 million and sells to Gensa at $43.5 million, leading to a loss of about $52 million US. The minority have waded into the discussion, dragging the GNPC leadership to explain the conditions of the contract to the Mines and Energy Committee. On Thursday, John Chinapo is spokesperson.
In the spirit of accountability, transparency, and ensuring that the right thing is done, and even in accordance with law, don't forget that the Petroleum Exploration and Production Act, Act 919, makes it clear that GNPC's activities and work program ought to be approved by Parliament. In fact, until we embarked on this tour, this issue never came to Parliament. And so that's the first problem that I have with this whole agreement. Why would GNPC go ahead to sign such far-reaching agreements without recourse to Parliament? Why would GNPC decide that they would not even inform Parliament as part of their work program? And so that for me is very, very fundamental. And I can confirm to you that we are summoning GNPC to appear before the Mines and Energy Committee this very Thursday. It's a very serious issue, it's a grave issue, and Parliament ought to assert its authority and ensure that the right thing is done. That is one. 2 is that it's only PURC, the regulator, that has the mandate and the authority to approve the tariffs or the prices for landed gas. And in Ghana, the weighted average cost of the gas is about $6.08 per MMBTU. And so GNPC cannot, without recourse to Parliament, without approval from the regulator, reduce that price by about half. That sounds very, 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 very weird. That sounds very alarming. And that is why we are summoning GNPC to explain to us, 1, on what authority, 2, why did they do so, and why would they decide that they will give that rebate, reducing the price by about half. That sounds very, very, very serious.
The minority is also faulting the role of the Economic Management Committee, chaired by the Vice President, Dr. Bawumia, for approving the deal. They say the deal is not transparent and did not follow due process.
I've also cited documents where the Economic Management team appears to be giving some approvals. The Vice President is the head of the Economic Management team, and I want to make it clear that, in my opinion, he doesn't have any right to vary those prices. So the Economic Management team itself ought to be questioned, and the Vice President ought to be answering questions as to why they will grant such approvals. That is clearly in contravention to the Petroleum Revenue Management Act. The Act is clear how our natural resources ought to be sold, how those revenues ought to be lodged in the Petroleum Holding Fund. And so these are very, very serious issues. These are grave issues. I am aware that GENSA already had an agreement with Ghana Gas where they were buying this same gas at about $7 per MMBTU. So what has changed for GNPC to now step in, come up with all these very, very suspicious prices and eventually have it signed? We believe that we should support indigenous Ghanaian companies. We should encourage the private sector. But that must be done in accordance with law. It must be done with due process. There ought to be transparency. First of all, like I said, the price of gas is paid by the consumer. It's not paid by government. And if you look at the computation for the price of gas, there are basically three main items: the commodity itself, the cost of processing, and the cost of transportation. Those are the ingredients the PURC factors in order to come up with the weighted average cost of gas. And it's the consumer that pays. Moreover, this gas is being used to supply the mining companies. They are providing power to the mining companies. And so what is so special about Ghana's mining companies that they ought to be heavily subsidized when other industries that manufacture, say, agricultural produce, that adds value to agricultural produce, that produces, say, water and other essential ingredients, ought to be paying a higher tariff? Why that distortion? What is so special about the mines? They are mining their gold to sell. What about all the industries in Tema, all the industries here in Ghana that is generating jobs, Ghanaian-owned industries that are trying to survive? Why should they pay the 6.08 in terms of the price build-up, weighted average based on gas, and then the mines will be given a dispensation of just about $3? It doesn't make sense. Is it fair? Is it equitable?
Well, the minority is also accusing GNPC of not focusing on its core mandate and wading into areas away from its mandate.
It's not the duty of GNPC to go on following how that gas is processed. That's not the mandate of GNPC. They are losing focus. That is why for the past 6 years we haven't discovered any oil. The national oil company must refocus, re-strategize, and concentrate on finding new wells and adding more oil to our existing stock, because already our existing stock is beginning to deplete, is beginning to diminish. And so if GNPC wants to get involved at the refining level and go down below from upstream to midstream and to downstream, it is losing focus. And for me, that is most unfortunate. Let GNPC sell the raw gas and take its hand off. Whatever happens in the value chain, it shouldn't be the job of GNPC.
What are your suspicions? Because you have not only raised these concerns, Imani, ASAP have all raised these concerns, and they are saying that the deal seems to them like sweetheart deals. They raise concerns about Jensen raising money on the international markets and saying that it seems as though some of these deals with government is probably what has bolstered their books for them to be able to get some of these deals. What is your suspicion as to why GNPC is getting involved in this, particularly the pricing aspect?
That's why we are summoning GNPC. At least there's evidence that, contrary to what PURC has approved, GNPC is selling that gas at half the price. What should account for that? And there's also evidence that the Vice President and the Economic Management team are deep and neck deep in this whole brouhaha. And so clearly, our duty as members of Parliament is representation. We would investigate this matter in a very dispassionate manner, in a very fair manner, in a very transparent manner, and we would be very, very clear and swift on our findings. And I can assure you that we will not hide anything, we will not cover anybody. We want to ensure that the country is saved and saved very, very well. And that is our commitment.
Away from energy, let's look at health now. The Ghana Registered Nurses and Midwives Association is calling on government to urgently present the insurance packages promised to frontline workers. During the peak of the COVID-19 pandemic, President Akufo-Addo proposed incentives for frontline health workers, including insurance packages. But some health workers who were victims of COVID-19 say they are yet to receive any package. There's more in the following report.
Ashanti Regional Secretary for the Ghana Registered Nurses and Midwives Association says none of its members who were victims of COVID-19 has received the insurance package. Patrick Tete says this is causing disaffection among members.
Since the inception of COVID-19, frontline health workers, including nurses and midwives, have been facing a lot of challenges. The major challenge is the insurance package the government promised all nurses and midwives, which stated that nurses and midwives who will be infected with the virus will be having or receiving insurance packages. As at now, we've not gotten any information from our members who had the COVID-19 of getting those insurances. So we use this opportunity to plead with the government to go back to the drawing table and reactivate that insurance policy to boost our members' morale so that they can educate the public the more.
He was speaking at a training program for health workers on vaccine hesitancy. The training by the Ghana Health Service is to adequately arm the health workers with knowledge to handle people who have developed dissatisfaction with the COVID-19 vaccines. Health Promotion Officer at the Regional Health Directorate, Salibaba Owusu-Addo, says though the region is not recording new cases of COVID-19, there is a need to build herd immunity.
We have not recording figures as we used to, but when we go to the advanced areas in the developing countries, they are still recording even deaths when it comes to COVID. But for us, because of the work that we have put in as a service for Ghana Health Service in collaboration with our partners, people are not really coming on board because, number one, they think that the COVID is over. It is not over. And the vaccination is not a cure for COVID. It's for protection.
Religious beliefs, fear of vaccination, and side effects of COVID-19 vaccines are among factors crippling the intake of the dose. Ghana Health Service says the hesitancy rate among health workers is minimal, but there is the need to retain them to lead public education.
We wanted to increase the immunization coverage of the COVID vaccine so that at the end of this presentation, we'll be equipped with knowledge so that you will get enough to tell Ghanaians, and even we nurses ourselves will get a lot of information and knowledge so that we can educate the members and the general public on the uptake of vaccine, especially the hesitancy, the myth regarding the uptake of the COVID vaccine.
For Joy News, Emmanuel Kweku reporting.
David Tinkran is the General Secretary of the Nurses and Midwives Association. He joins us via Zoom for some more on this story. I know that you've been at this for a while, but is there commitment on the part of government to pay what is due your members?
Good evening, my brother, and good evening to your viewers. I think this question can best be posed to the employer or the government. As far as I'm concerned, I'm not seeing any sign of they doing the needful, because we have been at this for a very long time, as you said, and I don't know what's happening, but we still think that people deserve whatever they were promised, and it's incumbent upon government to do what is necessary.
You say you do not see the sign, but you're well aware that we are in difficult times. We have economic challenges as a country. Are you willing to let this go?
I don't think so. Once it was promised and the people delivered, we really have to respond positively. Don't forget that COVID is still with us. It's not gone yet, all right? If you listen to what the lady said, we are even trying to intensify the processes where people could increase the uptake of vaccines. That is why we are running these workshops nationwide, to be able to educate our members to, even they themselves get themselves vaccinated and extend education to the general populace. So I think that once COVID is still around, the government should do the needful. They deserve it, especially those who have lost their lives and those who ended up at ICUs and all that. Our people broke their back, taking care of the good people of this country. So I don't see any reason why government should renege on that responsibility at all.
What do you say to those who say that provided your salaries are being paid, and other allowances due you also coming through your account, it shouldn't affect your work at all, as you have heard some of your members say. They say what, morale is down, but salaries are coming through, your allowances are being paid, and given the times in which we are, that should be motivation for you to continue your job to the nation, service to the nation. And we've seen health workers, especially nurses, leave in droves. Could this be one of the incentives, the fact that government reneges on such, promises, especially when you put your lives on the line? The description is right. You were frontline health workers. And so when you see government reacting this way, could this be some of the factors motivating some of your members to seek, greener pastures elsewhere, especially in Europe?
Absolutely. I mean, if motivation is low, and it can form as one of the drivers of migration. And people are living in droves, as we said, and they continue to live because there is no motivation to stay in Ghana. I mean, whatever you are even promised is not paid. So if you can also travel to another jurisdiction and take care of people with COVID, okay, and when you even fall sick, you'll be taking care of. Most of our people, when they fell sick, they had to take care of their own medical bills and the rest of it. I mean, you work in a hospital as a nurse or as a midwife, and when you fall sick, you still have to foot your bills. This is unacceptable. And some of these things are certainly the push factors, and they will continue to live if we don't sit up as a country and see and recognize what the people do as nurses and midwives in this country.
Well, David, I'm grateful for your time, but the Ghana Health Service has been responding to some of the issues you raised. Today, the service says it is establishing staff clinics at regional hospitals across the country dedicated to the caring of health workers and their needs. The Director General of the service, Dr. Patrick Apawu, says the move is to ensure that staff return to work quickly as soon as possible. Speaking at the close of the 4th Patient Safety and Healthcare Quality Conference in Sunyani in the Bono region, Dr. Apawu said this initiative would also encourage staff to give of their best. Precious Emefa has more.
The closing ceremony of the 2022 4th Patient Safety and Healthcare Quality Conference climaxed with a sword cutting to commemorate Patient Safety Day and create awareness of medication safety. According to the Director General of the Ghana Health Service, Dr. Patrick Apawu, their existence as a service in the health sector is to ensure that patients are safe. He said the service would continue to put in measures to ensure that the safety of patients as a process improves.
We continue to make progress. We continue to see more people, which is an indication. We continue to see a reduction in mortality, that is deaths and illness and disability. So quality is a process. Patient safety is a process, and so we continue to improve the services to ensure that the patient safety is number one. What we are saying that you should not be harmed when you come to our facility. You should rather receive care and go back healthy. It's a human institution, so we continue to put systems and remind ourselves that this is what we are here for, and we're going to work towards ensuring that patients are kept safe. When we give you medication, you advise providers to take them safely so that they don't take a medication. That will rather leave more, give you more problem, like overdose, and underdose, or the wrong medication. So that is what we are focusing on also this year, among other things.
Touching on the welfare of healthcare workers, Dr. Apawu revealed that staff will no longer join queues to seek healthcare when staff clinics are established.
One of the things you have noticed is that when you are at the lower level and you are not well as a health worker, you may not be able to seek care at the level that you are working. You may need to move up. So we have established a system of clinical staff clinics, irrespective of wherever you are based. You can access all the care, but the service is one, and that's why we are at the regional hospital to establish staff clinic where people can come and seek care quickly and go back to their work instead of coming to queue and not being known at that level. So that's what we're trying to do, improving their welfare, among other things.
The 4th Patient Safety and Healthcare Quality Conference was under the theme Advancing Patient Safety and Quality During Public Health Emergencies. Precious Emefa, Joy News, Sunyani.
And here in the studio in Accra, I'm Ernest Mino with Joy News Prime. We're taking a break, and when we return, Becky has the latest in showbiz. Stay.